A stroke can happen anywhere in the brain, and so it can affect different things if it happens on the right side, left side, posterior, anterior. But in general, there's typically a loss of function, motor function, so they can't move their arms as well as they could, they can't move their legs, they might not be able to swallow as well, and sometimes their cognitive faculties, the way they think, is altered as well by the brain, suffering the stroke. Our therapists, physical, occupational, and speech therapists, will attack all those things. The physical therapist will work on strength and endurance and balance with getting that patient moving again. The occupational therapist will make sure that they're able to do the normal activities they were doing before, whether that's dressing themselves, bathing themselves, grooming, feeding. And then the speech therapist will both work on any active issues with feeding or swallowing as well as communicating, but also some activities for their brain function to make sure that they're able to think through. So the facility provides a lot of things in terms of it has a large gym space. There is a kitchen that's here that we could practice cooking on. There are parallel bars, exercise machines. We have a simulated surface that patients can walk on. So a lot of patients don't always have a sidewalk. We have steps, we have grass, we have gravel, we have bricks. And so a lot of simulated environments that they can perform here at the facility under the safe supervision of a therapist to prepare them for going home. The main thing about strokes is that you want to start your therapy as soon as possible. By being close to home, that therapy can start sooner. They can have the support of their family when doing it, both in education and training for when they leave here, but also so that the patient's spirits are lifted up and that they have the support they need mentally and emotionally to get through this process. When they come to rehab, I think they get motivated by our therapists because we've seen a lot of strokes and we know what to expect from them and we know the outcomes can be achieved. And so just learning certain things and how to redo things, I think it's uplifting to patients to know that, you know what, I still can survive after this stroke, I can still have a meaningful lifestyle when I leave here, and that is the goal, is to go home and still be able to do all the things they were doing before.